Yes, thank you, Bina, and thank you, Mandar. This is a great discussion, and I just wanted to make three quick points. I mean, I think the point about how public health challenges bring out disparity and inequity, I think, has been laid very threadbare by this pandemic. But we in public health deal with this in all programs, large public health programs. Polio eradication has been no exception. It's the poorest and the most marginalized and the most vulnerable. And also, they're not only epidemiologically and biologically more vulnerable, they're also economically extremely vulnerable. So both the direct and indirect consequences of these outbreaks have a devastating impact on their lives and livelihood. So I think in terms of the call to action, what I would see are two important tracks that I would recommend for the group to consider. One, of course, is the activism and making sure that there is sufficient investment going forward in public health systems. And this is a huge problem across the board. We in public health go through what we call cycle of panic and neglect. We are right now in a part investing in health infrastructure, investing in public health. And when this crisis is going to get over, we will go back to the old ways of neglect, the cycle of neglect. So I think what all colleagues have said, there has to be a concerted effort now, both in the public sector and private sector, is to invest more in public health systems. Thirdly, my final point would be is that what we have learned in programs like polio eradication and others is the building of resilience within the most vulnerable communities. And this is something that really is like organizing and mobilizing communities themselves. So they are not just passive recipients of either aid or devastating consequences of an outbreak, because that's where there is so much social and even economic resources available in the poorest communities, that if we help them get organized and build self-reliance and resilience, they go a long way. And I think this is something at the grassroots level. We need to look at that. How do we build both health and economic resilience within these marginalized communities? Just you wanted to ask me about the polio program. I mean, I think the polio eradication frontline force has been the first responders in India, in Afghanistan, in Pakistan, and possibly in Nepal. I don't know the details, but in these three countries, I know for sure because I've been a part of that network. And we've lost people have died. They're the ones who are doing contact tracing and surveillance, for COVID-19, distributing personal protective equipment. But this is all on the back of a pre-existing investment in the polio eradication program. What we need is a holistic across-the-board investment in public health, so that after polio is eradicated, we still actually have an intrinsic and well-built public health system can deal with all kinds of outbreaks, and that always prioritizes to be effective are the most marginalized and the most vulnerable. Thank you. Back to you.
For the opportunity. Thank you for the excellent work and initiative. I just want to make just few points quickly. And I think we had a good kind of discussion even on email regarding the charter, resolution and whatnot. I want to congratulate Bina for initiating the peace process and involving health as an important element, which I think is an excellent idea, because I think health is a very good entry point into the common man in each nations of South Asia. Unless we really touch the common man, we will not be able to push the agenda for peace.